Hello and a very warm welcome to you this Thursday evening. As the Prime Minister continues to be treated for coronavirus in an intensive care unit, tonight the reality of what it's like to treat some of the sickest patients on the front line. NHS staff tell us the physical and psychological toll is like nothing they've ever experienced. It's the first time cameras have been allowed into the ICU at St George's Hospital treating critically ill COVID patients. With a special report, here's Carl Mercer.
It's the scale of it that is overwhelming. St George's in Tooting, like hospitals across London, has been transformed in weeks, wards being repurposed to cope with the growing number of COVID-19 patients.
This is the neurointensive care unit, or what was the neurointensive care unit. There are 14 beds on this unit, and if we just walk down, there's a side room here. We've got a patient in here on a ventilator. There are patients on either side of the ward here. All of these patients are on ventilators. They're all COVID patients.
The hospital has gone from 60 to 140 critical care beds and has plans to go to more than 200 if needed.
We had a lot of preparation and we knew what was coming, but I think there's only a certain amount, there's only so much preparation you can do. And it was a very sudden, sort of 2 weeks now we've had it. And patients are incredibly unwell. And it's a total change of type of patient that we're used to.
I used to do neurointensive care on here as a consultant, and walking in and seeing this level of sickness here is actually a little bit jarring because it's very different. This used to be our quietest, most civilized unit, if you like. The patients tended to be reasonably calm. It was a very controlled environment, whereas now some of our sickest patients are being looked after.
The team, I think, have just been unbelievable. Not just the nurses here, but we're getting lots of support from everywhere else.
Let's draw yourself slightly onto my side on your count, Andrew.
Okay, on three. 1, 2.
Okay.
Help like this from the orthopaedic surgeons, retrained as a new team to help turn patients onto their fronts, a process known as proning.
So essentially, a lot of our patients who have low oxygen levels in their blood will benefit from us turning them onto their fronts. And it sounds relatively simple to do, but it is actually quite a complex thing to try and achieve when you have somebody connected to so many machines.
So we've expanded into our operating theatres, we've expanded onto wards, we've taken over medical wards and essentially repurposed them into intensive care units, in some cases in 48 hours.
So this is our latest ward to open up. These people have machines to help them breathe, and it's not quite full ventilation that we've seen in the intensive care units, but it's stuff that needs a higher level of training to manage these people on these devices. These are still very sick patients.
So I was working on a respiratory ward downstairs in another wing. So I came back from annual leave and they sent me straight over here. So I've been here for 2 weeks since it opened. There's a lot going on now, lots and lots.
It's not a nice disease for us, it's very hard to manage. Patients don't get better quickly, and psychologically it's really hard for even the experienced ITU nurses to deal with that. Not to mention the ward nurses who are parachuted into an unfamiliar environment and having to deal with this for long shifts. Psychologically, really tricky even for experienced intensive care staff.
Staff are working longer hours in stressful conditions, and George's is using its own specialist mental health teams to support them.
It's actually very tricky emotionally, you've got to kind of just get stuck in and help each other out really. But we've got a support team that comes around and helps out. Our matron's lovely, everyone's really supportive.
You have to say that because he don't sound
No, he's lovely, Chris, he's great.
Yeah, I have 2 boys and a wife, and without them supporting me when I get home, it's practically impossible. And I'm lucky because I have someone to go home and offload to, but some of our staff don't have that luxury, and it's really important we look after them.
So if you want to help the NHS cope and try and save more lives, then please don't be tempted to bend the rules this weekend, even if it's a lovely hot sunny day in Easter and all the rest of it. We've been working on this for 2 months now. You've been in lockdown for nearly 3 weeks. Please don't be tempted to bend the rules. They are working, they are helping us. So thank you.